in primary care for individuals with spinal cord injury, and really represents part of the development of a collaborative primary care spinal cord injury network. So this network really aims to bridge gaps in primary care for individuals with spinal cord injury through research, education, increasing resources, and networking various stakeholders and general advocacy. The network is to provide opportunities for increased engagement with stakeholders and greater knowledge translation in the hopes of really establishing a Canada-wide collaborative network eventually from all stakeholders, and developing and disseminating best primary care practices and assisting in knowledge translation, establishing a standard in primary care for individuals with spinal cord injury, and promoting knowledge sharing and collaboration through really a multifaceted approach, not limited to education, including research projects and various meetings. And just speaking about meetings, there will be a primary care summit planned for April of this year. So please note that, and we will be sending out announcements to inviting everybody. My name is Joe Lee. I'm a family doctor in Kitchener-Waterloo at the Center for Family Medicine. We have a mobility clinic. So Jamie Milligan and others and I work on various projects through and working with organizations like Praxis and ONF. And our research manager is Lindsay Byerman, who is going to actually just help us with introducing our speaker and giving us, going over through some housekeeping items as well. Lindsay?
Perfect, thanks, Joe. So just a few reminders before I introduce Jasmine. Please remember to mute your microphones. There will be an opportunity for questions, and we invite you to put your questions in the chat as our team will be monitoring them throughout the presentation. So today's presentation is being recorded and will be shared afterwards. We will also be sending out a feedback survey, so if you could fill that out, it would be greatly appreciated. And we'd also like to thank and acknowledge our funder, Praxis, who is supporting our work around this webinar series. So I think that's about it for housekeeping. So it's my pleasure today to introduce Jasmine Ma. Dr. Jasmine Ma is a postdoctoral fellow at UBC and Arthritis Research Canada. Funded by CHR, the Michael Smith Foundation for Health Research, and the Arthritis Society, her research focuses on physical activity, behavioral science, and integrated knowledge translation. Combining her research and role as a kinesiologist and inclusive fitness trainer, she works with clinicians and people with chronic conditions and disabilities to develop interventions to start and stay active. Relevant to today's presentation, in collaboration with over 300 stakeholders, including people with SCI, clinicians, researchers, SCI, BC, and funders Praxis and the ONF, Jasmine and her team have developed resources and training on physical activity, coaching tailored to people with SCI, which she'll share some key take-homes with you today. So, Jasmine, it's all yours.
Great. Thank you, Lindsay, for the introduction, and likewise, Joe. It's really nice to see some familiar faces and some names on there. James, I hope things are going well in Kelowna. So thank you so much for having me today. I'll share, a few key insights today that I think are kind of fun to talk about. But by any means, if at any point you've got questions, as I mentioned, post them in the chat. I won't be monitoring the chat myself, so I'm not ignoring you, but we will get to it at the end. And likewise, I'll have my contact information if you want to talk about anything more at the end. So before I start with the juicy stuff, I just want to share how excited I am to be presenting here today. And this topic is really quite important to me. And this is just a snapshot of a few of the individuals I've worked with over the years. And, my role as a kinesiologist and a trainer with them is really special. And, a lot of the things that I'll talk about today are actually lessons that I've learned from them. Another reason why this is really special is some of this work came from my PhD, which was back in, I started my PhD in 2014. At the time was sponsored by ONF and Praxis, which was then the Rick Hansen Institute. Praxis still sponsors our work today, and so we thank them for their funding. But really cool to kind of come full circle and see, work that was done back in my graduate studies, so the implementation work that we're doing right now in hospital. So that's kind of fun to think about how that's come over the years. Okay, so I'll prime you now. I really love pulling from the audience and getting people engaged. So you've been warned. So who's in the room? I'd love to see it, with the exception of Randy, because you're driving. 5 arm circles backwards if you've ever talked to someone about their physical activity or your own physical activity. You can do single or double. And if that doesn't work for you, you've got shoulder rolls as well. Doesn't that feel nice? Okay, great. So from what I can see, I think we've got a few people that have talked about their own physical activity or someone else's. So what are we going to talk about today? So I'd start with identifying the evidence. So a snapshot of the evidence for physical activity interventions among people with spinal cord injury. I won't hang there for too long. The bulk of what I'll talk about today are strategies for promoting physical activity. And then the last bit there is really just the Q&A. I'd love to be here to help you problem solve to how you might have a physical activity conversation in your own setting. So starting with our first objective, again, just a snapshot of the evidence here. The approach that I'll talk about today was grounded in a large body of evidence that we're so fortunate to have phenomenal collaborators. Dr. Jen Tomazzoni, Dr. Kathleen Martin-Guinness, Dr. Tony Williams, myself have all led different reviews, systematic reviews, and metasyntheses that have basically told us what are some of the things that get in the way for someone with a spinal cord injury to be physically active, and what are some of the solutions that we can use to help support an individual to be more physically active. So that led us to a long development process, engaging our end users. So in this case, it was individuals with spinal cord injury and clinicians, researchers. And we went through this process to basically ask, if we're going to develop an intervention, how should we do it? So that brought us to developing the Proactive Sci Toolkit. And I'll go into greater detail, but it basically centers around 3 principles that we use: education, linking referral, and tailored prescription to help someone with spinal cord injury to be more physically active. Now, I won't belabor this too long, but just to give you an idea of the support that we have that this may work. We have seen in a randomized controlled trial these intervention among people with spinal cord injury, very large size effects on moderate to vigorous levels of physical activity. Likewise, we've seen improvements in fitness, and these improvements in fitness are enough that it's important for changes and improvements in health. And this I can basically summarize here. These are psychological constructs, but essentially to say that this intervention helped to increase confidence, perceptions of support individuals have to be physically active, and also those strategies that you can use to help you stick to your physical activity. So to summarize all of that together, why are we talking about this approach today? We do have some evidence that demonstrates the efficacy of this type of intervention. Right now, we're examining more along the lines of effectiveness in the hospital setting at GF Strong out here in BC and in collaboration with Spinal Cord Injury BC. But the main take home that I want to stress here is, Lindsay mentioned, this intervention was developed with over 300 stakeholders. So this isn't my brain. My brain couldn't do all of this. This is a collaboration amongst many. The other thing to keep in mind is we're continually adapting this intervention and our approach. So by all means, if you have feedback, we'd love to hear it. Moving on to our next objective, talking about our strategies. This is the fun stuff. Well, it's all fun, but here's extra fun. So a couple of resources to share with you today. If there's anything that you'd like, I'm happy to send these resources out. Perhaps I can send it through Lindsay. This is the form we currently use in hospital for helping to guide our physical activity conversation. So to give you an idea, we kind of have 2 layers here. The second layer is, the deeper layer, where this toolkit is around 50 to 60 pages, gives you the full gamut of, what we would like to share and how to promote physical activity. And this is kind of like the 2-page summary. So if you want somewhere to start, you start with a 2-page summary. And if you want to know more, you can access the Proactive Sci Toolkit. It's on the SCI Action Canada website, or I can send that link through Lindsay as well. So I mentioned I'll unpack this a little bit more. So education, linking, referral, and tailored prescription are the 3 components that we focus on. So first of all, education. What is physical activity? How do we do it? What are some of the behavioral strategies that we can use to help us stick to physical activity? Secondly, linking and referral. Physical activity is a lifelong behavior, which makes it complicated, which also means sometimes we need more than just one individual to help us support our physical activity. So it might be important to link to other programs, peers, and organizations, many of which are on the line today. And then writing and developing a tailored exercise prescription. So I'll go into a little bit more detail to give you some of the background on all this and how do you actually do it? So step 1, we want to get a sense for if someone actually wants to be physically active. So I call it kind of the proceed or plant the seed model. So if they're not interested, maybe we just want to plant the seed about, the benefits of physical activity. Or maybe you want to probe a little bit more depending on your relationship of why they're not interested in being physically active. And it might actually be that it's not so much that they're not interested, but there are things that are getting in the way. Now, if someone says, yes, this is something that I want to do, this is a behavior that I want to change, you go ahead through the proceed route. So if we are proceeding, we'll talk about what are we currently doing for physical activity? What would you like to do? And why is that important to you? What are the specific activities that you would like to do? What sort of resources do you have available? What are the things that might get in the way? And let's work towards developing a plan. Starting with what are we currently doing, we want to get a sense of how much, how often, and what are folks already doing. But keeping in mind, the majority of the population aren't doing very much physical activity or sometimes nothing whatsoever. And that's okay, right? We've all got to start somewhere. So that's okay. The important thing is here, where do we want to go? So how much physical activity do you want to be doing? But the big take home here is why? Why do we want to become more physically active? Is it because you want to be able to transfer independently? Is it because maybe you've got kids or grandkids that you want to be able to pick up and throw in the air, right? What are the things that make being active important to you? So I'm nosy, and I'd love it if you could type in the chat if you have hands free, or you can also, you're welcome to mic in here. Why is physical activity important to you, if it is something that's important to you? So I'll just take the chat here, see what we see. Yeah, Jamie, I hear that. Keeps you sane. Dana, yeah, it makes me happy. Sports, 100% could have performance goals, emotional, physical health. Yeah, it feels so good to be strong. I love, love, love hanging with people when I play sport. So I love beach volleyball. I'm there for the people. Yeah, maintain independence. These are all fabulous reasons for why we want to stay active. So thank you for that. Then we want to get to, and sorry, I'm going to play around with my screen here because sometimes my mouse goes away and that's what solves it. That's how I figured it out. So apologies. Then we want to know, what is it that you want to do? Like, what are the types of activities that are exciting? It's really great if we can make physical activity something that we are excited about rather than something that feels like a chore. So if someone tells me they loathe the arm ergometer, I'm not putting them on the arm ergometer, because the second that I'm no longer there, they're no longer using the arm ergometer because they don't like it. And that's fair, because oftentimes, it's, you're posted up against a wall, that's, you're just staring at a wall and your arms are going, but some people like that. So I want to know, what do you want to do? I also am curious to know, do you prefer exercising by yourself? Do you like the social interaction, as I've seen in the chat there? Would you prefer to be outdoors rather than indoors? I have people that tell me that I don't go to the gym because it stinks. Fair reason. I accept that. What about your resources? So if I'm developing an exercise prescription, but you tell me that you don't have access to a gym, it doesn't really make sense to program with these crazy machines, right? So we want to be mindful of what we have access to for facilities. Right now, it's really important to know what we have for equipment right at home. And I'll talk about some different things that we can use for equipment so we don't have to get too fancy. What about if anyone requires assistance or other types of support? And depending on what you want to do for physical activity, it can get expensive. So what kind of access to funding do we have, or what sort of resources can we pool, especially if anyone wants to get into, for example, wheelchair sport? We know those sport chairs are very expensive. And this is my default. So I'm really fortunate. So I lived in Ontario for a while, and so I know SCI Ontario is a fabulous organization. I'm really fortunate to be out here in BC, and SCI BC has just had my back over the years. So I like to think of them as like pressing the easy button. The number of times I've called the 1-800 info line and been like, hey, so I've got so-and-so in Langley, and I'm not sure like what's the closest gym, or who can I connect them with if they want to get into hand cycling, etc. And Heather and Bert have all the answers. If not them, they know who does. So, don't reinvent the wheel. Contact your provincial SCI organization, because they are a wealth of information. And there are other organizations too that I'll list that might fall in that category. Another thing that I'll draw your attention towards, and just before I explain this, I'm also going to have you just in the chat, and you can hop on the mic too if you prefer, just to share any sort of physical activity resources that you currently use. We can use this as a way to help us, build our resource list. So I'll leave you to put that in the chat, and I'll just explain this now. So one of the courses that I teach is adaptive physical activity, and my students I'm going to gloat about them. They are amazing. But we've seen a need for online physical activity resources in our COVID-19 sphere. So right now they're actually putting together an environmental scan of online synchronous classes, apps, videos for strengthening and cardio, online physical activity counseling and coaching and training services, exercise support groups, podcasts, anything that we can find online that is, for the most part, we're trying to find freely available and online accessible. Now, this is, I find, where you get some of the most interesting and important pieces of your physical activity conversation. Is I think a lot of us come in, with really great intentions, wanting to be physically active, but there are things that are either within or out of our control that make it really hard sometimes. So oftentimes people have a good sense of the most salient barriers, the things that get in the way. But another strategy you can use to help guide that conversation is using a model called the COM-B. So just like committing a crime, you need the capability, opportunity, and motivation to commit a crime. Same thing for a number of different behaviors, including physical activity. So I'm going to ask if anyone is brave enough to be a bit of a volunteer for me. I'm just going to ask you, what I'd like you to do is think of a health behavior that you'd like to change. It could be something like flossing more often, doing a better job of brushing your teeth, whatever you'd like it to be. And I'll invite you, just anyone that would like to be a volunteer. I'll give you a moment to think if you'd like to volunteer. Just check the chat. And if I don't see anyone volunteer, maybe I'll volunteer Joe or Lindsay. Oh, we've got Krista Shore. Krista, are you comfortable to come on the line on the mic?
Hi, yes, it's me, Krista.
Hi, Krista.
I'll very much appreciate your time for presenting. So I always feel bad I'm like, yes, of course I will volunteer. I've been in your place and you're like, please, someone just say yes. So I'm in.
Yeah, I appreciate it, Krista. I've taught enough now that I've become very comfortable in silence. So I will wait.
Okay, good to know. I
appreciate the lifesaver.
Yeah, I also have a physiotherapy student from the U of A sitting with me today too. So I was almost going to throw under the bus, but maybe we'll together to two people. So
that's great. That sounds lovely. Well, thank you, Krista. I appreciate it. So Krista, do you have a health behavior in mind that you'd like to change?
I would say that maybe, so I can think of the flossing example is a really good one because I'm not a very good flosser. I can see from the camera that maybe you are much better than I am at flossing.
Because my Invisalign does a good job of hiding it, right?
Very amazing. So that's an easy one. And I guess like it's January and I'm trying to, I'm pretty good on the exercise front and sleep front and things like that. But maybe in 2021, a little less of the recreational alcohol use after work would be something that could be relatable. So either of those would probably be, if I have to think about 2 health behaviors I could be better at.
Sure. Yeah, well, you know what? I like the floss one because it's an easy conversation and we don't have to get too personal.
Okay, perfect. Let's do that.
Yeah, do you want to do floss? Okay, so let's do that. So, Krista, probably just an easy question. Do you, and this is going to sound ridiculous, but do you know how to floss?
Yes, I do know how to floss because my hygienist has showed me a number of times. So yes, I do.
Great. Okay, so it's not, the issue isn't really knowing how to floss. What about like, are you physically able to floss independently?
Yes.
Yep. Okay, so that's good.
Hands work well.
Check.
Yes.
Yeah. And what about is it something that like flossing, is that something that like you need someone else to help you to do? Like for example, like if you see, your partner or family member flossing, you're kind of like, oh yeah, like maybe I should floss, or having someone to tell you, oh, maybe you should floss. Is that something that's helpful or something that you already see?
Yes, I would say that my partner is much better at dental care. He flosses very regularly. We always have like a floss in my house.
Yeah, and right. And
So,
everything's a
yes.
competition, right? So if he's better, then
yes. Now, if the competition is who has better dental visits, I win that one for sure. So I feel like maybe that's part of his motivation.
There's give and take.
Yes.
That's great. Okay, so it sounds like maybe your partner is good at flossing. Maybe that's a motivator. Maybe they can play a part in helping to remind you. So every time they floss, they might say, "Hey, Krista, it's about that time." That's what I do with my partner.
Yes.
I know it doesn't work for him, but try as I may. What about, do you have access to floss?
Yes, always in the house.
Okay, great, awesome. And what about, so motivation wise, is this something, it sounds like, because you've mentioned, I asked you, is this something that you want to change? So it sounds like kind of your reflective motivation is there. It's something that you want to do. But is there ever something that you kind of forget to do by chance?
Yes, always. I feel like my nighttime routine is sort of when it pops into my head that I think about it, but by the time I'm kind of getting ready to get into bed, I'm like, I want to be like in bed in 2 minutes or less. So I feel like the wash the face, brush the teeth, and get in bed. And then once I'm in there, there's no way I'm getting out. So I feel like it's not a habit that I have regularly. That I find it hard in the bedtime routine. That is usually pretty quick to add something else in. So that's a bit difficult. And I guess just on the motivation piece, I've never had a cavity, so I don't really understand
so there's
why
no repercussions.
There's no consequences. Like I just have never, I know I could be, I know I want to be better when I go to the dentist. I would like to like not have them be like, you really need to, it would be easier for your cleanings if you just, but then there's not really any other than like a bit of a harsh cleaning sesh that's a bit tough on my gums and things. And they assure me that would be easier if I did it more frequently. There's no real kind of super negative dental consequences to me not flossing my whole life.
That makes sense, Krista. Yeah. Well, that's great. So you've given me lots of information. So Krista, you are officially off the hook.
Okay.
But what it sounds like is that maybe there's something in there around like automatic motivation. So, something about your routine, you mentioned, just before you're going to bed, you want that 2-minute routine, you're already in bed, right? So maybe something that might be helpful is having the floss at your bedside table, right? It's kind of a prompt or a cue to help you remember. Likewise, you kind of tapped into social opportunities. So your husband as a motivator, but also your hygienist, maybe giving you some flack for not flossing, right? Does that kind of sound like maybe some reasonable strategies?
Yeah, certainly.
given some of the, yeah,
Yes,
great,
definitely. I
awesome.
think, yeah, always in terms of like behavioral change stuff, the habit thing is really important. So I guess if it was somewhere where I couldn't ignore it, like right on my bedside
Yeah.
table, that would make then there's no excuses. So
Yeah, you've got it. Well, thank you so much, Krista, for participating. I really appreciate it. Nice to chat with you.
you too. Thanks.
Great. So, there's kind of a funny example. Flossing is a simple behavior, but those same questions that I posed can be used in the physical activity context as well. So we want to get a sense for, in terms of capability, is it something that folks know how to do? Are you physically capable? Is that a skill that you possess? In terms of opportunity, do you have the people around you to support you, or the access to resources and things available for you to be able to able to be physically active? And is this something that you want to do, or is there something that you need some help in making it more of a habit? Okay. So I use the combi all the time in my everyday life. Probably my partner is the victim of it the most. But yeah, a really kind of I'd say a scaled back, simplified tool for using behavior change in our everyday interactions. Okay, so moving on to our last section here, and this is, really the fun stuff. I keep saying everything's fun, but of course, we're progressively getting more and more fun. Is developing a plan. Key things that we'll talk about here: behavior change techniques, resources, peers, adapting common exercise prescription, and then a little bit around what we can do for an exercise prescription. Now, there are over 90 behavior change techniques out there. Behavior change techniques are strategies to help us do the behavior that we want to do. The top three, so graded tasks, SMART goal setting, and action planning, they all kind of fit together in a way. So graded tasks is just making sure that we're setting small, achievable goals. So we kind of get that confidence boost every time we see like, oh yeah, like I set a goal for myself to go for a wheel for 5 minutes and I did it. That means I know that I'm capable of doing it. Maybe I'm more confident to try a little bit more next time. SMART goal setting, I think most of us have kind of heard. SMART stands for specific, measurable, attainable, realistic, and time bound, right? And that kind of goes along with action planning. So, making a plan where you know what days you're doing, when you're doing it, where you're doing, and what you're doing. Prompts and cues, we talked about a little bit with that with Krista. If forgetting to do something, sometimes setting yourself a phone reminder or having something physically there in your sight can help you to remember to do whatever it is that you want to do. Monitoring is keeping track, right? We see a lot of folks with, Fitbits, different monitoring devices, or you can do the old-fashioned pen and paper. And then there's reward. So not all of us are at the point where we have that intrinsic motivation where we're just like jazzed up to do physical activity because we love physical activity. Sometimes we need an additional motivator to get us there. So, sometimes it might be like, I'm going to buy myself that fanny pack that I've been really eyeing up, is of course what most people are looking to buy, as a reward for, setting your goals for them or hitting your goals for the month. Now, if I was to put my chips down on one or two of these behaviors, I'm going to put it on action planning and monitoring. So this is an example action plan that's pulled from the SEI Action Canada website. So really specific. So we can basically paint a complete picture of what we're doing for our physical activity. And the second piece of that is monitoring. So we've set this plan. How well are we doing to stick to it? This is a list of key resources. This is certainly not exhaustive, but just to pull yourself to a couple of key resources here. So as I mentioned before, SEI Action Canada has a wealth of resources, one of which is Active Homes, where they have strength training videos and a booklet of different exercises you can do with the resistance band. And likewise, from the same group comes the CDPP. This is, Kathleen Martin-Guinness and her team are just a powerhouse in Canada and internationally for physical activity and spinal cord injury. So I'd say anything that her and her group does, you can guarantee it's good quality, great quality work. Another one I'll point you to is Nickpad. So it is an American organization, but if you're looking for videos with people with different abilities exercising, this is probably the best compilation I've seen to date. So lots there. And I can also maybe copy and paste that to Lindsay if she wants to share that as well too. Peers. So I think the best way to describe the role of peers is through story. So this is actually a friend of mine, Rob Shaw, and I think if anyone is familiar with the wheelchair tennis circuit, they know the name Rob Shaw. So Rob is actually currently doing his PhD with Dr. Kathleen Martin-Guinness, brilliant individual. And so before his injury, he was a bit of a local tennis pro. And I apologize, Rob, if you come to listen to this, I'm paraphrasing what you've told me. But yeah, a bit of a local tennis pro before his injury, and after his injury, you're obviously thinking about things like, can I play tennis again? And one thought that really struck his mind is, how am I going to hold a racket? If anyone's here from SCI Ontario, you might know Gary. Gary is an SCI peer mentor. I'm not sure if he's still around in his role as a peer mentor today. It's been a while since I've been in Ontario. But Gary was a pretty big game changer for Rob. He got him out to go and play tennis. And the thing that Rob shared with me that was really important there was, Gary taught him how to tape the racket. So what can we do to supplement grip? And yeah, if you know Rob today, he is one of the top internationally ranked wheelchair tennis players in the world. So obviously Rob's put in a lot of work since his time with Gary, but he does attribute as that's one of the sort of TSN turning points for Rob. So peers can be really powerful. Depends on the individual. Sometimes we're ready for that, and sometimes we're not. But if we are, then it can be a really powerful strategy. Okay, so common exercise equipment. Now, we have some really amazing specialized gyms, across Ontario, right? We've got things like Power Court at Brock, Revved Up at Queens, Mac Wheelers, McMaster out here in BC. We've got Park and iCordo. Amazing, amazing equipment. Really cool because these facilities were designed with accessibility at the forefront. Now, that's not always the case that we have that available. As I mentioned to Joe and Lindsay, my hometown is a hometown of 3,000 people. We have three streetlights, as we talked about. So we don't have access to gyms like that. We do have a community squash club gym. And there are components there that we can use that can be made accessible if you're aware of how to set up your gym space and how to use it. So the number one thing that I would say it can be an accessible piece of equipment is a pulley system that doesn't have an attached seating setup. So big thing there though is just to make sure that there is space for a chair to be able to operate in different positions with a pulley. Free weights are another one, but depending on hand function, we might need things like active hands to assist with that. Resistance bands, these are $5, right? You can get your hands on resistance bands. You can do pretty much any exercise with a resistance band. Medicine balls are another common one that you'll see at any sort of gym, but are particularly helpful if they have handles. And then cuff weights are another one that we would commonly see in a gym. So if you're wondering about, is a gym space accessible for me, number one, you have to figure out is the space accessible? Can I get into the gym? But once you're in, to get a sense of, okay, what are some of the things that I could use in a typical gym? This is where I'd probably point your attention to start. Some other things that I really encourage, and we've been really fortunate to have some conversations with gyms across BC. These are some relatively inexpensive things that you can add to your gym or things that you can use at home. So active hands that I mentioned, right? Those are grip assistance gloves. They can be a little bit expensive though. So I think they're within the $100 price range or so. Likewise with the neoprene waist binder. If someone has difficulty with core control, sometimes we'll use a waist binder to help support the core so we don't have too much wiggling side to side. Wristics are another thing that we will typically see in a gym. You might use that for really heavy bar lifting, but can also be for things like if you've got a pulley system, you're using a bar, for example, doing a lat pull down. Those wrist hooks, so they kind of have like a wrap around the wrist, and they've got metal hooks, can be used to supplement grip as well. If you don't have access to things like active hands, tensor bandage is the cheaper option. Just mindful, it does take a bit to wrap the tensor, and you'll need someone to help you with that. The next one I stole from Megan Williamson from Ocean Rehab. She uses a lot of like dowels and broom handles for different cardio exercises. So that's another good one that we've got at home. Resistance bands. One of my clients actually had a really great idea. I don't have the sweatband here, but I tie a loop in the end there. So if grip is challenging, we can hook around the wrist. One of our clients actually has like sweatbands that she'll tie to the end. It's a little more comfy. But again, if you have difficulty with gripping, that's a solution. And of course, soup cans. Today's flavor is Campbell's tomato. Many people have soup cans. If not soup cans, basically, if you want to, weight up anything you can find from Costco, you can use a backpack to add different items to make a heavier item, and jugs with handles might be some other ideas for things that we can use at home. So our last section here is on exercise prescription. And I want to share the spinal cord injury physical activity guidelines. I'm sure many of you have seen this already. But what I really love about these guidelines that make it quite different from our general physical activity guidelines is that these are based off of minimum thresholds. So our 150 minutes of MVPA that we see in the general guidelines, which have also been updated for the 24-hour movement guidelines, if anyone's interested, they're really cool. Those are based on more optimal levels that you would need to achieve more optimal levels of health, but aren't the minimum threshold. So what I like about these guidelines is they provide a starting level and an advanced level. So the starting level is how much you need to do to improve fitness. And the advanced level is how much you need to do to induce cardiometabolic health benefits. So things like decreasing your risk for cardiovascular disease or type 2 diabetes or metabolic syndrome. So it starts with 20 minutes twice a week at moderate to vigorous intensity. And I'll explain that intensity in a bit for the starting level. And that increases to 3 times a week, 30 minutes for the advanced level. And in both cases, it's important to do our strength training at least twice a week. Now, that being said, that doesn't mean we all need to start there. These are the goals that we would like to aim for down the road and work towards exceeding them. But if you're starting somewhere lower than this, that's okay, right? We don't have to, come out guns a-blazing right from the start. We can work our way up there. So I mentioned I'll expand on intensity. Intensity, I find, is our One Fitness, our prescription component that I find is the most challenging to provide education on. So I personally use our 1 to 10 scale. How hard are you working on a scale of 1 to 10? 10 being, as hard as you could possibly work. 1 being, you're chilling at home on the couch. Another really useful strategy is the talk test. So especially if we're doing aerobic activity, right, more of that continuous activity, you might say for moderate intensity, you'd be able to talk, but not sing a song, right? You'd be kind of gasping for breath to do that. So that's a good indication of moderate intensity. For vigorous intensity, you'd need to be pausing every few words for a breath. For strength training, I find it helpful to think about how many reps you have left in you at the end of the set. So if you feel like you can go forever, it's probably mild intensity. If you think you have a few more reps at the end of your set, we're working somewhere around moderate intensity. And for vigorous intensity, at the end of your set, you can just barely finish that last rep with good form, or maybe you've only got one rep left with you. That's more along the lines of vigorous intensity. So those are just some different ways that we can describe intensities that I find a little bit more helpful in the community setting. Okay, so decreasing sedentary time, another thing I love to do. So you can join me in trying these movements. These are 4 exercises you can try today, and I just apologize. Finding pictures with diverse abilities are really hard to find. If you're looking for physiotherapy exercises, physiotherapyexercises.com have really great resources and pictures of people with spinal cord injury and other abilities, and having accessible pictures. But yeah, for these exercises, I apologize. I tried my hardest, and these were the best I could come up with. So nonetheless, 4 exercises I'll show you today. So the first one is a supinated band pull apart. And I'm just gonna pull my desk up here. So you're welcome to join me, or you can just, watch me do my thing. I can't see you, so I can't judge whether or not you are. So you can do this seated or standing. So supinated band pull apart, hands are up, right? And you're pulling the band apart. And as you're pulling the band apart, you want to think about squeezing those shoulder blades together. And you can do that across different ranges of motion. So above head if you can, and if not, lowering. You can modify that if you want to bend the arms. It makes it a little bit easier, but we try to do straight arm. The second one is a seated row. So you can attach your TheraBand to any sort of anchor you have. Oftentimes it's a door handle or you widget in the door, right? And similar concept here where we're pulling, I'm gonna pull this down here, pulling the band in towards our ribs, squeezing those shoulders down and back. Really nice pull motion. If you're anything like me, I spend a lot of time at my desk and I look like this at my desk all the time. I really need to focus on that pull. Another one that we've got our tomato soup here today, is the Arnold Press. So working from a bicep curl to shoulder press, right? Options here for seated or standing. And you can also, if you want to modify it, you can also break those exercises up. So you're doing just bicep curl or just shoulder press. And then if you're ambulatory, if I was to put my money down on one lower body exercise, it would be the squat. And we've got options there, right, for a full squat through to a quarter squat. Go through the range of motion that challenges you optimally. Okay, so hopefully that's given you a little bit of a snapshot for different strategies we can use to promote physical activity. I'd like to take the rest of our time to have a bit of a Q&A, a little bit of a chat. If there's anything that I can offer, I'm not going to have all the answers, but I could try. If you'd like to chat about how we can support you to have that physical activity conversation in your own setting, I'd love that opportunity. But before we do that, one more opportunity for movement, 5 arm circles or shoulder rolls, if you think that you'll have a conversation with someone else about their physical activity this week. It's part of my job, so I will. Great. And of course, many thanks. As I mentioned, this page could not be filled with enough space to thank everyone who's contributed to the work that we've presented here today. Thank you.
Great, Jasmine. And maybe we can open it up to either chat or just unmute for questions. There's one in the and also not just to ask questions, but also to discuss or to provide answers, since we have lots of people who are in the know here. And I noticed in the chat, Alexander says, "Is there a gym in Toronto?" Does anybody know the answer to that?
Yeah, I'll leave that to the Ontario locals. I know like we've worked in the past with Lyndhurst, but that's a specialized center. Yeah, I'm not sure if anyone has Propel Physiotherapy, I think is again, not a community gym, but a group that we've worked with that I think are out of it's the Toronto area, and we have 2 locations. They're a really great group that do specialize in neuro rehab. But if you're looking for a community gym, Variety Village. Yes.
Yeah, I see Tony
Anthony.
Burns has put Variety Village.
Yes,
Jamie,
thank you.
You're unmuted. Or are you going to say something, Jamie, or not? No.
No, I was just going to mention that Tony mentioned that there.
We've got a question from Ashley, the action planning slide. What was the resource for this? Yes. So it's in both so if you check out saiactioncanada.ca, and I can share that link with Lindsay to share with the group. They've got a number of resources. One of them is in their toolkits. So it'll be both in the Proactive Physical Activity Toolkit, as well as I think they still have their Get Fit Toolkit. I believe they've got an action planning resource in there too. But essentially, you want to know what you're doing, for how long, when, at what intensity, and where you're going to do it. Yeah, thanks, Ashley.
Hey, Jasmine, can I ask a question there? Excellent presentation. Love the interactive nature.
Thanks, Jamie.
We won't send people to tackle you. I apologize for that. We'll have to find out where you live first.
Yeah.
But I did have a question, like in one of your slides, you sort of had a screening question there. And so this is kind of an important thing in primary care. We often sort of want, a really quick, good screening question that works. But your question in the one was, are you interested in being physically active or doing things to move your body? Have you guys researched that? Or has it been researched in terms of, is it a good screening question or do you know, or?
Yeah, that's a great question, Jamie. So nothing on the psychometrics of that question in specific, but what that came from was in development with our partners. So people with spinal cord injury and physiotherapists. It also has some backing in psychological theory. So knowing whether or not, it basically tells us whether someone has the intention to be physically active or not. So that we pulled from the health action process approach model, which kind of separates, pre-intenders, intenders, and those that are doing physical activity. So, those that aren't thinking about being active, but just haven't gotten to be there, and those that are currently active. So yeah, it's grounded in theory as well as through collaboration. But from what I've seen, it's in terms of feedback from what we've had in the hospital setting, it does help our physios, which are the bulk of the clinicians that are using it right now, get a sense for whether or not they should invest that time right now in that conversation.
Yeah, thanks. I think it's something we could we could use and reword the way we ask that in our mobility clinics as well. Yeah, and I would encourage you too, Jamie, as you think through how to reword it, to involve your patients and your collaborators into thinking about what's the best way to phrase that for your setting. Yeah, no, I like your wording. I think we'd reword the way we're doing things to reflect this. Yeah, right. Yeah. Thanks. Of course. Charlene, oh, such a good question. How do we keep going? Any tips or strategies for supporting maintenance and sustainability after individuals have reached their goals? I think if we've done a good job with our screening process and our, our physical activity conversation, hopefully we've found, some examples of activities that are interesting enough that we develop that intrinsic motivation. So that motivation where we're doing this because it's for us. We know it's good for us. It's fun, right? So that's one thing, is tapping into the right activities. The second thing is understanding that barriers and what gets in the way changes over time. So maybe having the opportunity to check in, say, hey, how are you doing? Is there anything that I can help with that, has anything changed that's making it hard to get active? Monitoring is another good one. And I think, what we see in practice a lot is the accountability is a really big one. So if you, maybe you've talked about it with your partner or a friend, you meet up with someone every week to do your exercise. That's a really good way to help people stick to it. So it's a really great question, Charlene. And I think it's one of those, it depends. And that's why I think it's so important to ask these questions, because that answer is going to be different for everyone. Yeah, a great question. Craig has a great question. How soon after spinal cord injury should you bring up the topic of exercise with the patient? So we currently have physiotherapists that work in inpatient. So we're working with people, pretty soon after their injury. Some of them are having the conversation quite early on, so before they're discharged from inpatient, and some aren't. It depends on the individual. So yeah, I think as soon as you can, and as soon as someone's ready. Oh, yes. And correct me if I'm pronouncing your name incorrectly, Alexandra. Are there different considerations for heart rate targets as a measure of intensity? Alex is fine, thank you. So yes, especially for those that have injuries at T6 and above, sometimes we have, our innervation to the heart is affected. So what we would typically have for maximal heart rates is going to look very different than an able-bodied individual. So that's why we typically don't use heart rate as a great measure of intensity. And that's why I default to things like more descriptive, like the talk test, ratings of perceived exertion to talk about intensity. So heart rate gets tricky. I see Tony just mentioned first year so is often consumed by formal PT. Post 1 year is a good time to develop long-term strategies. Absolutely. Yeah. And keeping in mind too, in that first year, so many things are changing. So once you've been discharged from hospital, there are different priorities. So one of the strategies that we use in that transition from hospital to community is planting the seed that we've got, for example, out here in BC, we have Spinal Cord Injury BC that can be that link for when you're ready. So the therapists talk about physical activity in hospital, they make the connection to Spinal Cord Injury BC and our peer coaches. And then, if they're ready,
right out of the gate at discharge, great. If you need some time to sort things like, housing, transportation, like those are, priorities that you need to sort out first, then they're there ready to support when it's the right time. This is the silence I've gotten very good in sitting in. Alex, are there any amateur adaptive athlete competitions in Canada? I'm not as familiar with the sports sector, so I wonder if we have anyone here in the sports sector that can offer some insight. And if we don't, SCI Ontario or SCI BC, depending on where you are. Yeah, I saw Randy, you unmuted.
Yeah, no, I couldn't tell. I didn't know if I was muted or not while I was driving. So I'm
Oh, no problem.
Okay.
No problem.
And sorry, I missed the question about the last question you said about if people are involved in the sports sector. I missed the question that was asked.
Yeah, so Alex had asked if there are any amateur adaptive athlete competitions in Canada. And Nadine's offered, so there are provincial wheelchair sports organizations across Canada.
Yep.
So out here we have the BCWSA. They've got programs like Bridging the Gap, and yeah, there's lots of different entries. There's Paralympics, but yeah, usually my default for that is connecting with our provincial SCI organization, and they usually know the right people to kind of get your entry in there. Yeah, Krista, lots of great adaptive ski programs out here. Whistler Adaptive Skiing out here. And again, I apologize because a lot of my stuff that I know is out here in BC, but we've got BC Moss, which is British Columbia Mountain Outdoor Sports. And yeah, lots of excursions that they do. Yeah, skiing, hiking, all kinds of stuff that's adaptive. Yeah, Tara, nice to see you. Parasailing, absolutely.
I just wanted to, if I could pipe in just for 1 second.
Sure.
There was a part of a research project that we're doing right now is looking at online physical activity during COVID. And I have one of the participants is a C6 complete quadriplegic, and she used socks that she filled with rice that she then tied around her hand to use for extra weight. So it's amazing the amount of things that you can come up with for adaptive equipment. It amazed me. It was so great. So she used it to add resistance to the aerobic activity we were doing.
Yeah, absolutely. I love that. Yeah, that's really kind of the secret that I've found for, exercise equipment is how creative can you be?
Oh, yeah.
I like that, Randy. I'll share that with my clients.
Brilliant.
Yeah, that's great. You can always use that rice later for cooking, right? Waste not, want not.
That's right. Little extra salty seasoning to it, though, from the sauce.
Yeah, you've got it. Anything else that I can answer? And if it's not striking you now, as I mentioned, my contact information I can share with Lindsay. Feel free to reach out. But yeah, it's been a real pleasure chatting and getting to share some of the things that I'm really passionate about. And thank you all for coming today. I'm not sure if I'm supposed to be closing, but sorry, I just did that.
Well, thanks, Jen. We want to thank you for presenting to us with a really great presentation, and want to thank everybody for attending. As well, just a reminder that this is part of a series, so that we'll be forwarding information for the next webinar. And we will also be inviting people to the Primary Care Summit in April. Jamie, did you want to send us off with any profound words?
Yeah, I know. Just thanks so much, Jasmine. That was excellent and really well attended. All these webinars have been really, really well attended. So as Joe said, there's going to be more coming. You will get an evaluation sent to you by Lindsay as well, everybody who's been participating. And I think we'll also have a survey as well about topics for upcoming presentations, which has been really useful for us to schedule. So thanks everybody. Look for those things upcoming in terms of invites, and And thank you again, Jasmine. Thanks everybody for participating. Everybody stay safe and be aware of anybody tackling you.
Yes.
Thanks, everyone. It's nice to see you all.
Thank you very much for your presentation.
Thanks,
Yeah,
Randy. Hopefully you've arrived safely.
Oh, yes.
Good.